Application. Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hi, everyone. Welcome back to my show. Hope, hold on, pain ends. I am your host, Susan Plummer. I apologize for the raspy voice. I have been out sick with something terrible for the last week. My kids are both getting over it as well, so we've been a pretty sick household. So I apologize if I have to cough or for the way I sound, because I don't sound too appealing right now. But again, thank you so much for tuning in. Today's show is about medical cannabis, how I obtained my medical cannabis card for myself and my caregiver. Now, I reside in the state of Illinois, so I'm just going to be talking about Illinois and what I know from my state. Now, I'm pretty sure that it does differ from state to state, considering that not all states have the medical cannabis program. So you can find your information on your local state's health department website. Now, in Illinois, this is a pilot program, and it's called the Compassionate Use of Medical Cannabis. This program is for adults, and it also includes children under the age of 18. Now, they are limited as to what their parents and caregivers can purchase for them. They do not have the availability of everything that an adult does have in the program. I believe there is 24 debilitating conditions that are currently covered in the state of Illinois. I'm not going to list them all because there's no way that I can get my tongue to pronounce half of the things that are on there. But just a couple of things. I know there is PTSD on there. There's lupus, multiple sclerosis, several other autoimmune disorders, HIV, cancer, of course, and several others. And of course, that also can be found on our Department of Health website for the state of Illinois. Now, a little bit about my story. I was diagnosed with multiple sclerosis in 2015. I started working on getting my medical cannabis card in August of 2015. Now, back in August, the state of Illinois only had one doctor who was authorized by the state of Illinois, by this medical cannabis program, to sign off on a medical cannabis application, and his name is Bodo Schneider. He was also the only doctor for the state of Michigan. So this doctor was going from Michigan to Illinois and back to Michigan to see his patients. Now, back when I first applied in 2015, how it worked was you go to see this doctor. You have to visit him for a minimum of 3 office visits to establish a patient and doctor relationship. You are supposed to meet with Dr. Bodo Schneider, who was my doctor for the state of Illinois at the time. You're supposed to meet with him 3 times. It's 3 visits. So the initial visit is a background of all of your health issues, your diagnoses, and then you fill out all the forms, their office forms, mostly HIPAA forms, and you list all of your medical history, where they can obtain it, hospital, doctors, and where your diagnosis came from. And then you have a follow-up visit, and your 3rd visit is physical. Now, my first 2 visits were done with his medical assistant. I only met Dr. Bodo Schneider on the very last visit, and that was the physical examination. The total for 3 visits, plus the application fee for myself and my caregiver, who happens to be my husband, the total cost out of pocket for us was $500. And that does not include fingerprints for both of us and passport photos. That was an additional $125 for both of us. So the entire cost was $625. Now, currently how it's changed is you can go to any doctor. You can go to your doctor, your neurologist, your medical internist doctor, whoever's willing to sign off on it. You can go to them and they will sign off on the application for you. Now, back then, Dr. Bodo Schneider, again, was the only doctor. And during the time that my application was being processed, Dr. Bodo Schneider was actually investigated by the FBI, by the feds, state and local government for not adhering to the rule of doctor-patient relationship. They'd come to find out that he was not meeting with the patients for 3 visits. Because like I said, in my experience, I met with his medical assistant twice. I only met Dr. Bodo Schneider for the last visit, which was the physical. So he was under investigation here in the state of Illinois as well as in Michigan, and they were actually talking about overturning all the applications that he signed off on. So I was terrified at the time, and luckily that didn't happen. So basically, they ended up changing the law because it was so easy for one doctor to monopolize and then not adhere to the law because he was so overwhelmed with patients from 2 states. So I'm glad that they actually amended it to now any doctor who's willing to sign off on this. Now, you get a discount in the state of Illinois if you're disabled and on disability. So you get a discount on your application, and the application for your caregiver, you just have to send in with your application, your award letter from the disability, and it's about 50% off, which is huge. And that's for the initial application and then also to renew. I just renewed a couple of months ago, and it's a 2-year renewal. The first card that I was issued was only issued for a year. Now, when my renewal date came up, we were issued a card for 2 years. And I believe I only paid $125 for 2 years for myself and my husband, who's my caregiver, which is phenomenal. Now, today we're going to just start with CBD, and we're going to talk a little bit about CBD because there's so many components to medical marijuana. There are so many components to CBD, to THC, that we're going to have to go into further detail. And it's going to take several shows over the course of the next couple of weeks to actually dive into everything. Now, CBD in the brain. CBD is amazing. CBD is legal in all 50 states, but you cannot purchase CBD from a dispensary. You have to be a medical cannabis card holder to enter any dispensary. So you can get CBD because it's legal in all 50 states. I know a lot of smoke shops sell it. I know you can go on a lot of different social medias, Instagram, for instance, Facebook. There's a lot of companies from Colorado and California that make different CBD products, which is pretty amazing. And they come in drops, tinctures, edibles, topicals. So they're creams, there's patches, you can vaporize it. It's pretty amazing. But the thing is when you buy CBD from one of these companies, they're not being tested for microbiological myotoxins, residual solvents, pesticides, and contaminant analysis. And for people like us with chronic inflammatory autoimmune disorders like MS, it is very important that whatever we ingest is solventless, so it doesn't contain any residual traces of butane or any other solvent that is used in order to bind or thin out or to change the consistency of the plant itself. So when you do purchase your CBD from one of these companies, there is no testing being done. And if there is, it's not done on a state level. It's not overseen by a state agency, so we don't really know how clean the product is as far as any kind of contaminants. And again, it's very, very important that the product that we ingest are contaminant, solventless, and toxin-free. Now, CBD is a cannabinoidal. So CBD is one of at least 113 active cannabinoids identified in cannabis. It's a major phytocannabinoid, and that it's 40% of the plant's extract, which is huge. Now, like I said, again, CBD comes in oils, tinctures, edibles, topicals, patches, creams. You can vaporize it. They're selling it as shatter, as wax. You can actually dab with it alone, or you can add it on top of your THC wax, and it's amazing. CBD is also safe for pets. I give my dog a CBD pet treat, which I do get from my local dispensary. And she is doing great because she has a condition that she was born with, where her hip dislocates and she walks with a limp, and this is really good for her pain. Now, CBD is amazing. It relieves pain, inflammation. It heals the neuropathic pain that we feel. So a lot of MS sufferers suffer from neuropathic pain, which is MS pain. And it does really work great for that. It works great for schizophrenia, anxiety, sleep disorders, addiction to opioids. It fights cancer. It's great for nausea, especially for pregnant women and cancer patients. It's amazing for seizures. And that's why a lot of children are on some type of CBD tincture, because it is amazing for seizures, specifically epileptic seizures. It reduces your incidence of diabetes. So if your hemoglobin A1C or your glucose levels are high and you're on a strict CBD diet, there have been tests proven that it does reduce those numbers, especially in children, which is amazing. It promotes cardiovascular health. Again, it's treated for epilepsy, MS, lupus. It's amazing for appetite stimulant, again, for cancer patients and AIDS patients. And it's also an amazing antioxidant. Now, CBD is one of many cannabinoid molecules produced by cannabis, second only to THC in abundance. These are plant-derived cannabinoids, or phytocannabinoids. Photo is plant in Greek, and they're characterized by their ability to act on the cannabinoid receptors that are a part of our endocannabinoid system. Now, we actually have an endocannabinoid system. This is something that we're born with. So when our body gets THC, our receptors go off in our brain and they start activating our endocannabinoid system to start defending us against that list of conditions that I just mentioned. So just think about it. We actually have an endocannabinoid system. So in retrospect, we were made to take this plant and use it in all of its glory, which is amazing. So while THC is the principal psychoactive component of cannabis and has certain medical uses, CBD stands out because it is both non-psychoactive and it displays a broad range of potential medical applications, and it's safe for children and pets across the board. Now, let's evaluate some of the evidence that's out there. Now, perhaps the most remarkable thing about CBD is the sheer number of variety its potential therapeutic applications are used for. It is important to recognize that each application may be supported by different levels of evidence, and there's lots of ongoing clinical trials evaluating its efficacy in the treatment of human disorders, to animal studies investigating its behavior and psychological effects, to in vitro work. So test tube experiments measuring its pharmacological interactions and mechanisms of action. And each type of study comes with its own strengths and weaknesses, but we have come such a long way. We have come so far that now we have clinical studies going on, and it's amazing. So CBD is famous for its promise that it holds treating resistant forms of childhood epilepsy, like I talked about earlier. So there's a number of clinical trials testing the efficacy of CBD in human epilepsy patients that are currently underway. So again, these are children with epilepsy that are being given the CBD, and their parents are just seeing tremendous results. These children would suffer thousands of seizures a day, are now down to a couple. It's amazing. And it's amazing that we have come such a long way that there's actually trials going on currently. Now, CBD is amazing because it has neuroprotective, anti-inflammatory, and pain-relieving properties. And its potential therapeutic value in the treatment of motivational disorders like depression, anxiety, and addiction. And also not to mention schizophrenia as well. Now, we have receptor systems in the brain, as I talked about earlier. The brain contains large numbers of highly specialized cells called neurons. Each neuron connects to many other structures through something called synapses. These are sites where one neuron communicates to another by releasing chemical messengers known as neurotransmitters. Now, for MS patients suffering from a disease where our myelin sheath is being attacked and being eaten away, we lose those neuron communicators, and that's why our body malfunctions. So something like CBD is known to release chemicals that help our messages go from place to place in our neurotransmitters so that our brain functions properly. So this is amazing for us. Now, a neuron sensitivity to a specific neurotransmitter depends on whether or not it contains a receptor that fits that transmitter. It's kind of like an electrical socket fits a plug. So if a neuron contains receptors that match a particular neurotransmitter, then it can respond directly to the transmitter. Otherwise, it generally cannot. So all neurons contain multiple neurotransmitter receptors, allowing them to respond to some neurotransmitters, but not others. So we are born with this system that is made specifically for cannabis. And this is amazing. So our brain receptors are not only sensitive to neurotransmitters they produce naturally within the brain, like dopamine or serotonin, but also chemical messengers produced outside of the body, such as plant cannabinoids like THC or CBD. So when you ingest an edible or inhale some vapor, smoke a joint, smoke a blunt, hit a bowl, you're allowing compounds originally produced by a plant to enter your body, travel through your bloodstream, and enter your brain. Once they arrive, these plant-derived compounds can influence the brain activity by interacting with receptors on neurons. But they don't interact with all neurons, just the ones that have appropriate receptors. So they make the connection, and it just does its magic. And this is amazing. So the CBD influences many different receptor systems in our body. Just to go over a few of them. Now, although it is a cannabinoid, CBD does not directly interact with the two classical cannabinoid receptors, CB1 and CB2. Instead, it affects signaling through CB1 and CB2 receptors indirectly. So this partly explains why, in contrast to THC, CBD is non-intoxicating. You will not get that high effect. That's why it is safe for children, elderly, pets, anyone. And it doesn't interact with any other medicines that you're taking via prescription or over the counter. Now, in addition to the indirect influence on the CBD1 and CB2 receptors, CBD can increase levels of the body's own naturally producing cannabinoids, known as our endocannabinoids, by inhibiting the enzymes that break them down. So like I mentioned earlier, we have an endocannabinoid system already in place, and all it's waiting is for that trigger from either CBD or THC to start working its magic. Again, this is amazing, and it's even more amazing that moving forward, we're actually doing trials, and children are now involved, and children are seeing so many benefits from CBD. Now, even more intriguing to me is CBD also influences many non-cannabinoid receptor systems in the brain, interacting with receptors sensitive to a variety of drugs and neurotransmitters. These include opioid receptors. That's why this is amazing, and it plays a key role in pain regulation, as well as getting people that are addicted to opioids off of opioids. Opioid receptors are the key targets of pharmaceutical painkillers and drug abuse, such as morphine, heroin, fentanyl, and nowadays hydrocodone, also known as narco. CBD can also interact with dopamine receptors, which play a crucial role in regulating many aspects of behavior and cognition. Again, hello, great for MS, because for myself, I know I have a tremendous amount of cognitive issues. And when I don't use a only CBD product as far as flower goes, because I like to combust my flower, which is smoking it through a bowl or through a joint, I start losing cognitive ability. I start forgetting. I start stuttering. I don't remember things. I cannot connect the dots in my brain, and I feel myself slipping. This is amazing because it also includes motivation and reward-seeking behavior. So this CBD has so many different components, and the effects on the brain are endless. There's still so much that needs to be studied and evaluated, and only good things come out of this. You cannot overdose on THC or CBD. You would have to literally smoke in 60 minutes an entire pound, a little bit less than a kilo of flower or wax, and it is virtually impossible for one person to smoke an entire pound of marijuana in an hour, making it the most safest and effective treatment out there to date. Now, CBD also affects our serotonin system in a wonderful way. CBD's ability to target a specific serotonin receptor, the serotonin 1A receptor, is associated with a remarkable range of therapeutic possibilities. Now, Professor Roger Partway, a pharmacologist from the University of Aberdeen, spoke directly about the aspects of CBD biology. He quotes, "It's apparent the ability to enhance the activation of serotonin 1A receptors supports the possibility that it could be used to eliminate disorders that include opioid dependence, neuropathic pain such as MS pain, depression, anxiety, schizophrenia disorders, nausea, and vomiting that are associated directly with chemotherapy and pregnancy, negative symptoms of schizophrenia." And one big unanswered question is what the human clinical study and importance of each of these potential therapeutic uses of CBD identified solely by examining data from non-human preclinical research actually is. So given these possibilities come mainly from animal studies, more research will be needed before we can think seriously about human applications. Now, this is coming from the doctor. I'm your human application. Now, coming from me directly and the use I get out of it and how it helps me, it has kept me in remission. It is one of the things I use to stay in remission. It is one of the things I use to combat multiple sclerosis and the 20 diagnoses that are secondary to my MS. I use CBD and I use THC in the form of flower, wax, shatter, edibles, tinctures. I also use topicals, and this is how I combat my MS on a daily. Now, again, it's very important that you get your CBD from a reputable company because, like I said earlier, we cannot expose ourselves to any extra toxins coming into our body. So we have to make sure, if it's possible, that you verify where your CBD came from, if it has any tests, if you can get access to any of these studies or testing processes done on that specific CBD. But again, it is legal in all 50 states and it can be purchased virtually anywhere these days, which is really good. Now, I do recommend getting your medical card if you are in a cannabis-friendly state, so you can get CBD that has been tested through the state to make sure that it has its medicinal value. That's really, really important to us. Now I'm going to go over some strains that contain some strains that contain CBD, as well as some cannabis strains that contain THC and CBD, and just kind of go into a little bit about the difference of THC and CBD, because like I said, this is such a huge topic, and unfortunately, I'm getting tongue-tied thanks to my MS, but to explain thoroughly, this is going to take several shows. Now, cannabis lovers have long prized potency as one of the main factors that makes a particular strain more desirable than another. Now, for myself, I'm always looking for high CBD, high THC, something that's a 2-to-1 ratio. The highest in my state of Illinois, THC is 30%. And it takes a lot for me to feel the effects of cannabis, to feel the effects of CBD, to feel the effects of THC, because I have so many lesions in my brain, and my brain is basically a ball of mush. So, I can be smoking with someone, and after a couple of hits, their eyes are glazed, they're red, they're crossed over, they've reached their peak, and I'm still, and I'm fine, and I'm still waiting to feel an effect of it. So it is more desirable than another to make sure that the levels are high. Now, potency has long been popular in an illicit market, and the problem with illicit drugs and getting it from your street neighborhood drug dealer is that they aren't being tested. So when they're cultivating this cannabis, they're using pesticides and chemicals to make sure that their product isn't being eaten by bugs and it's not growing mold, and they can get more bang for their buck. So now, if you can't get it the legal way, I'm certainly not here to judge you how you get it, but it is very important that you know where your product comes from and that you know that it does not contain anything that could harm your system anymore. Now, traditionally, cannabis users attributed strain potency to high levels of cannabinoid THC, which has led the proliferation of strains that are full of it. So THC may be the most prevalent active compound in marijuana, but it is only one of at least 85 that we currently know of, and there's hundreds more. So thanks to marijuana's growing legitimacy as a medical option, which again, I am just head over heels for, I'm so excited because never in my lifetime, looking back 10 years ago, did I think that I would be able to come into a cannabis boutique and pick out my high-end premium cannabis. So to me, it's just something that I'm just still in shock that it's actually being less demonized and less criminalized than it was, let's say, 10 years ago. So now CBD is starting to emerge as the cannabinoid steel to THC's thunder because it is legal in all 50 states. It's safe for children. It's safe for pets. So just to name a couple of high CBD cannabis strains, CBD is the abbreviation. Now, pardon me because I can never get my tongue to say this word correctly. Cannabinoidal. The cannabinoid second only to THC when it comes to average volume. So recently, research has shown that CBD has to have pain-fighting properties, anti-inflammatory, anti-anxiety properties without the psychoactive effects. So you're not going to get the high or the stoned feeling from just CBD. That you can leave to THC. But while high strains of THC often tout levels of, like I said here in Illinois, 30%, generally CBD levels of 4% and above are considered to be very high because it is strictly CBD. Now, just a couple of cannabis strains and what they help. So it was initially thought that the cannabinoidal's main function, which is CBD, was to counter the psychoactive effects of THC. But more evidence seems to show that medically, CBD packs quite a punch on its own. It looks to be especially promising for conditions that are difficult to treat, such as Crohn's disease, PTSD, and multiple sclerosis. Lately, which is amazing, is one of the rarest of the conditions, which is called Dravet's syndrome. And it's getting a lot of attention from both the medical community and the public. Dravet's syndrome is an epilepsy debilitating form that affects children and is notoriously resistant to current approved treatment methods. Sufferers, which are children, are plagued by seizures, often up to hundreds to thousands a day, and that worsens with age, and it's also very life-threatening. So currently, treatment methods include having your child wear an eye patch, specialized diets, brain surgery, but all have mixed to little success rates. So through family stories of the successful management of Dravet's syndrome using CBD-rich marijuana strains, cannabinoidal, or CBD, is beginning to look like these kids' best hope. No, this does not mean that kids are smoking it. One of the early success stories involves a young girl named Charlotte, who was given a tincture version of Charlotte's Web. So basically, it's a liquid form. Sometimes it's in the oil. Sometimes it's mixed with something. Sometimes it's just a straight oil. And a couple of drops are put under the tongue. So Charlotte was giving a strain called Charlotte's Web, and it's a strain that was specifically developed to provide little Charlotte with all the benefits of the drug without the high. In less than 2 years, little Charlotte went from a monthly seizure count of over 1,200 to about 3. Other success stories followed, and more parents have begun to speak out, particularly parents who are desperate for access to the life-saving treatment. Now, you can find Charlotte's story on YouTube, and it's called Charlotte's Web and Zaki's Journey. Now, the video highlights Charlotte and her disorder, as well as the promising treatment of high CBD strains to help alleviate her symptoms. And if you watch this heart-touching video, I mean, it's just amazing what this little girl and her family went through and how CBD has changed her life. I mean, it's just amazing. Unlike pharmaceutical treatments for drugs, cannabis has no lethal dose. So like I said earlier, it is it is impossible. There's no way you can overdose on cannabis. It has no medical side effects, but it's still federally illegal. And you have to stop and ask yourself, why? Why is it federally illegal? Why are we withholding this life-saving treatment to children that are suffering every day? Why is this happening? And you just think about what drives this country. It's big pharma. And they make money off of us being sick. They make money off of the drugs that we take. And the government allows this to happen. Now, the fact that this condition affects children as young as a few days old makes it both a prime opportunity for non-psychoactive CBD-rich strains to shine, but it also makes it a touchy subject in a culture where cannabis has been demonized and so criminalized. However, the success of treating a condition that was previously often untreatable begs us to take a closer look at these three little letters, the FDA. And just think about the FDA, who runs it, and what it controls. Now, some strains vary from grower to grower and crop to crop and even plant to plant, female versus male. So keep in mind that the actual medications, CBD levels, may vary. And again, it also depends on state to state as well. However, here's just a couple of strains that I'm going to talk about that have been actively bred in recent years to have higher CBD levels. So they might be a good place to start for someone that's just getting their medical card, that hasn't smoked since college, or that has never smoked before, and you're not looking to get that stoned psychoactive effect. So there's only a few, but some in my state that I've tried are high CBD level strains. We have Charlotte's Web, we have Harley Quinn, Harley Sue, Sour Tsunami, Canatonic, and those are just to name a few. And again, these vary from state to state, crop to crop, and dispensary to dispensary.